People's Business is made possible by our partners, Solar Dynamics, the most efficient energy systems.
Welcome to the People's Business. I'm Sanka. Barbados' efforts to vaccinate its population against the deadly coronavirus have been relentless, both in terms of sourcing the vaccines in circumstances Prime Minister Mia Motley has sometimes described as the Wild Wild West, and through the National Vaccination Program, which officially began in February this year. It started with the Oxford-Zeneca vaccine, and the latest procurement has been a batch of Sinopharm, a gift from the People's Republic of China. Its rollout started last Tuesday, and here to discuss how that is going, answer your questions about Sinopharm and the vaccination process in general, are the co-coordinators of the National Vaccination Program, Dr. Elizabeth Ferdinand and Major David Clarke. We'll begin our discussion right back after this break. Welcome back to the People's Business. Major Clarke, could you update us on the rollout of the Sinopharm vaccine and how that has been going?
Thank you. Good evening. So the rollout, we started on Tuesday, and we've done just about 2,000 people. It has not gone as quickly as where we started with the AstraZeneca. And certainly the numbers of people who have registered are quite small for the next week. We tried to push people into registration, but over the weekend we did open days, and we will probably be doing open days again this week to try and get more people to come and take the Sinopharm vaccine.
Okay, where are the vaccination centers and what are the operating times so the public would know?
Right, so we have 8 vaccination centers, and the times vary depending on the time. They're actually on the vaccine website. So if you actually go to vaccine.gov.bb, you will actually see the sites listed. We try to drive people to register because in registering, it's able to populate the databases we use, the SHAPE app and the Medata. And that way we don't have to have the operators type in all the necessary information. If we can have people register before, then they can actually choose the site they want to go to, the date and the time, and then it populates the databases, and there won't be a long wait when you come to go. So the sites are, we have Queen's Park, the Art Gallery in Queen's Park, and that operates Tuesday to Friday, and all sites start at 10 o'clock, and our last appointments are at 2:30. We also have the Salters Masonic Center, and that's actually managed by 2 polyclinics. So on Wednesdays, it's managed by the Edgar Cochrane Polyclinic, and on Fridays, it's managed by the Glebe Polyclinic. We have the Sharon Moravian Church Hall, and that runs Monday to Friday. We also have the Seventh-day Adventist Church in Mile and a Quarter, and that runs on Sundays and Thursdays at present. We also have St. Philip Polyclinic, the David Thompson Polyclinic. And then normally we would have the Sandals Conference Center, but for the next 2 weeks, the site will actually be the Church Hall at Christ Church Parish Church. and that will run Tuesdays, Thursdays, and Fridays. And finally, we have the building number 2 on the Harbour Industrial Complex, and that runs on Sunday, Monday, Tuesday, and then Thursday and Friday, with their rest days being Wednesday and Saturday.
You made the point that people are not picking it up as quickly as the AstraZeneca. Why do you think this is happening?
I think there's lots of misinformation, and also people, Barbadians, I guess, are a little fussy about the type of vaccines they take. I get calls every day asking me when we're going to get Moderna, when we're going to get Pfizer. All I can say is what we have. As you've mentioned, the Prime Minister said it's like the wild, wild west. Sourcing vaccines is a difficult process, so we definitely have to use what we have.
Well, this would be a good time to bring in Dr. Ferdinand here. Well, tell us about the Sinopharm vaccine. How is it different from the AstraZeneca vaccine?
Good evening, everyone, and thanks for the program. Well, the Sinopharm is a vaccine that is made from an inactivated virus. So vaccines, generally speaking, can be made in several different ways. In this particular case, the germ itself is killed, or what we call inactivated, and then mixed with an adjuvant, and that makes the vaccine. Unlike the AstraZeneca, which we call a viral vector vaccine, where the germ is passed through a vector, and the vector produces like an antibody, and we use that then to inject into people to give the immunogenic response. The Moderna and the Pfizer are what we call mRNA viruses, vaccines, where the RNA of the virus is then modified a bit, and a piece of that is used as the vaccine. So there are different platforms, we call it, that have made up the vaccines.
Well, how effective is the Sinopharm?
Well, the Sinopharm has been pretty effective. We're at rates of up to 79% effectiveness. Many countries, as many as 80 countries throughout the world, have been using this vaccine and is still using the vaccine, because China has put out 2 vaccines, the Sinovac and the Sinopharm. And between the 2 of them, half the world almost are using them. We have to remember what Major Clarke just said in the availability of vaccines for countries, especially for developing countries. And so we have been forced to, first of all, get vaccines out of India and then out of some parts of Europe, and also now from China.
But so what is the skepticism? Because clearly there is this level of skepticism about this vaccine. I mean, people are saying it's no good. What if 80 countries are using it, it has to be good.
Look, vaccines have different amount of effectiveness, and I don't know why they're hesitant, but we like to define hesitancy as a state where people are not taking it up as fast as maybe something else, or they are actually refusing it. Now, we look at hesitancy under what we call the 3 C's. First of all, there's complacency. And that means there's complacency on the actual people themselves. They're putting it off. They'll go tomorrow. They're not interested now. They're going to wait and see. So the hesitancy could be because they're complacent. And we have to remember that we have done nearly 100,000 people, adults in Barbados already. So the mad rush, I don't want to call it a mad rush, but the rush for vaccines the first initial rush is, I think, over. We're now getting people who were complacent, who didn't come forward, who are seeing the numbers rising, the number of COVID cases rising again. And so they say, oh, I better have it. So they're now coming forward for what we have at the moment. So that's complacency. Then you have convenience. Are the vaccine sites and times of delivery convenient to the population? When we were in lockdown initially, people could come day or not night, but people could come anytime during the day. They weren't working. They were home. But now we're back to work and people don't have as much time during the working day to come forward. And that's why we've opened up weekend slots. Not many on Saturday because we find people are going to shop today. But Sunday we're open at some of the sites. And we're finding that the Sunday uptake is pretty good. And the third C is confidence. How confident are the people in the vaccine that we are delivering? And confidence can be associated with many different factors. It's like, how do people perceive how the vaccine is made? How is it being given? Is it the same intramuscular versus subcutaneous, or what type of vaccine it is? So confidence is one of the C's that contribute to what we call of the uptake of vaccines.
That's a good note for us to go to a Vox Pop that we carried out. I'll just get that roll so you can get some reaction from the public.
I'm not getting vaccinated because of certain allergic reactions that runs in my family. And plus two is a scare for me because I don't know if I get the vaccine, how my body will react towards it. And that's the whole purpose I'm not getting the vaccine.
No, I am not vaccinated. Reason why, I think it's too early to take the vaccine. I think that you need more studies and research done in relation to the vaccines.
I am not vaccinated. In the beginning, I had my reservations. I have seen that there doesn't seem to be any significant outcome in a bad way into being vaccinated. I have not rushed to get vaccinated because I am aware that there are people who it is more essential to get done at the moment. My circle is very small. I stay home, I work from home, I follow the rules. My interaction in general public is quite small at the moment. If I am required to be vaccinated, I have no issue with it.
Personally, I won't get the vaccine because it's not preventing me from getting COVID. But you have to get it to travel, and I do want to travel, so maybe I will get it. But for right now, it's a no.
All right. Basically, Dr. Ferdinand, there were these 4 points. Allergic reactions in my family, too early to get the vaccine, no significant outcome for being vaccinated, and it doesn't prevent you from coming down with COVID. I don't know if you would like to respond to that, to all these thoughts.
Okay, let's take one at a time. First, let's take the last one, where she said that, well, I can't remember if it's the last one, I'm not so young as I used to be. So anyway, the thing is that people have been hesitant people are allergic. And the rule is that unless you're allergic to that particular vaccine, ingredients in that vaccine, then you can have the vaccine. So because you have allergies in your family doesn't mean that you can't get vaccinated or that you should not be vaccinated, okay? Even when you do have your vaccine, there's always a doctor present. We have a medical kit there with certain drugs used in case someone has an allergic reaction. So as far as I'm concerned, that is not really an excuse to not have the vaccine. They talked about, one person said it was too early. I don't know what she's waiting for. Millions, maybe even over billions of people across the world have had one of these vaccines that are currently available on the market. As with any drug, even food, you can get a reaction. So with the vaccine, you can also get a reaction or a complication or an adverse event. But that should not stop you from getting the vaccine. The other matter was about it being too soon. Well, all the vaccines have gone through what we call phased trials. There's usually 3 phases of trials. When vaccines are developed, they go through 3 phases. The first phase is you have a few participants in the trial. You're looking for safety of the vaccine. You're looking to see, does this vaccine work? Does it do any damage to the person or the host? Is it effective against the particular disease that you've made the vaccine from? Then you have phase 2. That is successful. You go on to phase 2 trials where the number of people in each of the trials enlarges. So you have, instead of having a few hundred, you have a few thousand. Then in those few thousand, you break it down. You look at the children, you look at the people, the younger people, you look at the older or elderly, and you look to see how has this worked in the different ages, how has it affected them, has it prevented them from disease, and even what complications have occurred in the different age groups. And then you're going to, once that is successful, you're going to phase 3 trials, which are even larger. And they move sometimes into different countries. So you might have a trial in America, you might have a trial in England, Africa, wherever, even in Barbados. Not that we have had any trials, but it could come to that. You understand? So the phase 3 trials have all been completed, and the WHO and the regulatory authorities in many of the countries have approved vaccines, these particular vaccines, for emergency use. We need to remember that we are in a pandemic. And a pandemic means the whole world, all the countries are affected, and thousands of people are dying. So we need to look at what can stop this pandemic, how can we control it. And as you know, we've repeated this umpteen times, we have to do our social distancing, our hand washing, and our wearing of masks. And to add to that vanguard is the vaccination. And if you're vaccinated, one of the ladies talked about they're young, they don't see why they should get it. Because you are a pool of people who get COVID, you mightn't have symptoms, but you can spread it to your family, to your older people in the family, and to older people at your workplace, or people who you come into contact at the supermarket, etc. So that you need to be responsible and try and protect yourself, and to make sure that you are not transmitting or giving the infection to anyone else.
All right, thank you, Dr. Ferdinand. We'll take a commercial break and we'll be right back. We were just looking at some reasons given as to why people do not take the vaccine and the concerns. In the United States, of course, this is a major problem as well. In fact, we're now talking about, in the United States in particular, they're talking about the pandemic among the unvaccinated. And we'll just run the story so that you get an idea of exactly what is happening in the rest of the world as well.
Fueled by the highly contagious Delta variant and unvaccinated Americans, new infections are spiking 70%, hospitalizations climbing 36%, as deaths rise 26%.
This is becoming a pandemic of the unvaccinated. We are seeing outbreaks of cases in parts of the country that have low vaccination coverage because unvaccinated people are at risk.
With nearly a third of the nation still not vaccinated and COVID cases rising in almost every pocket of the country, the CDC says last week, 4 states accounted for more than 40% of new infections, 1 in 5 coming from Florida. In Nevada, the feds are deploying a team of 100 to desperately boost inoculations. And after LA County required masks inside public spaces again for all 10 million residents, other regions are now also recommending the vaccinated use face coverings indoors.
Well, in Barbados, we have 27% of persons vaccinated. And to get herd immunity, we need 70%. Now, Dr. Ferdinand, one of the things that's being said about the Sinopharm is that it really has not been approved globally. And I need you to deal with that. You said 80 countries already use it, but yet here, if you go on social media here, people are saying quite frankly, it has not been approved to be used. So could you deal with that level of misinformation?
Okay, first of all, I don't know what they mean by not being approved. All through the years, Barbados has been using vaccines that have been approved by the World Health Organization. That is our mantle
Benchmark?
or whatever, benchmark.
Yes.
So because we small islands, especially in small countries, do not have the facilities, the laboratories to test the drugs coming in, to all the drugs, to test the vaccines. So we rely on the World Health Organization to do just that, because they have specific labs that test the drugs, test the vaccines. So once it has been approved by the World Health Organization, Barbados, among many other countries, accept the vaccines. Now, Sinopharm, which is the one that we're using now from the Chinese, was approved on the 7th of May, 2021 by the World Health Organization for use in situations. The WHO also has approved the Pfizer, the Moderna, the AstraZeneca. Okay? There's some others that they have not yet approved, because to get approval, the company, particularly the company that has made the vaccine, has to send in all their research work, all the results of the phase studies that I spoke about just now, and trials, the composition. A lot of details have to go into the WHO, and the group of experts examine all of these. These are experts, what we call in the scientific association or SAGE meeting. The SAGE group look at all of these things, and they then advise WHO whether to accept or not to accept, whether they need more information, they need more trials, all these things. So this is not something that is just decided locally. This is something that is decided in a world scale area. Now, some large countries have the facilities where they can have what we call regulatory bodies who can do their own research, look at their own papers and say, yes, we accept. So some of the countries have accepted it on their own, from their own regulatory body. But it was in May of this year that WHO approved this particular Sinopharm vaccine. Okay?
All right. Thank you, Dr. Ferdinand. And of course, ladies and gentlemen watching, you can call us at 228-5562, 228-5562, or 228-5563, and get your questions answered. In fact, I think we have a call. Go right ahead.
Good night.
Good night.
Good night,
Good
Mr.
night.
Price.
Good night. How are you?
I'm fine, thank you. And good night to your guests. This question is for Dr. Ferdinand, right? My first question, why are they mixing the vaccines now? My second question, what are the ingredients in the Sinopharm? What is the chemical in the Sinopharm? Hello, can you hear me? And what is
Yeah, we
this
can hear you.
Yes.
Clearly.
aluminum hydroxide in this in Sinopharm? Can you explain that to me, please?
All right. Can you stay on the line just in
Yes.
case we want to ask you another question? So just stay on the line. Dr. Ferdinand, you can respond to her.
Okay, yes. Well, as when you say we are mixing vaccines, I'm not quite clear what you mean, but let me explain what I know. Initially, there was no mixing of any vaccine. If you had X for first dose, you would have X for second dose. Okay? And in Barbados, what we have been doing is you get AstraZeneca first dose, you will get AstraZeneca second dose. And that still applies for now. Okay? So people who had their first AstraZeneca dose, we have your second dose holding and waiting for you to come for it. Okay? So you will not be having any vaccines at the moment. What you need to know is that this is a new disease, and worldwide we're learning things every week or almost every day. So what they found in, I think it was in Canada, that they could mix one dose of Pfizer and one dose of AstraZeneca, and they seemed to get better results. Now, that was just one or two little studies that have been done. So it is not something that is worldwide accepted at the moment, but it's looking promising. Okay, so there might be mixing of vaccines later on down the road. Okay, because that leads me into something called variants. And what we found is that the virus mutates, it changes, it gets stronger, right? You hit it with one thing and it changes around. So the first vaccines that came out were made in response to the initial germ or virus. But there have been adaptations of that virus, and we call variants. And so those few studies that were done were looking to see whether by mixing the vaccines, because as I told you earlier, there are different types of vaccines, okay? Like cakes, you can have a fruit cake, you can have a plain cake, you can have a marble cake. So it is with vaccines. You can have different types of vaccines. And we told you were having either the mRNA, the viral vectors, or in this case, the inactivated vaccine, okay? So they found in those few small studies that it was effective. And that is why we're looking at this mixing. But at the moment in Barbados, we are not mixing, okay? The other thing was that we found that people coming into Barbados, visitors or people who had been living abroad and had their vaccines done abroad, they, in some cases, had a mixed vaccine. So the first one was different to the second. And Barbados looked at it last week, and they decided that we would accept those people as being fully vaccinated when they came in. because although I'm not in charge of that, and I don't ask me too many questions about it because that's not my mandate. But if you're not fully vaccinated and you come in, you have to undergo quite a long bit of quarantine. So that was why Barbados looked at it and they said, yes, we would accept once you've had two approved vaccines, we would take that. So that is where mixing has come in. So caller, understand that. Okay. Your second question is about the ingredients. And I don't have it in front of me, but yes, there is some aluminum hydroxide in there, which is used as an adjuvant. You remember I said at the beginning, I said that the virus was killed and it was mixed with an adjuvant, and that to preserve it, to make it be more active, to make it more, we call it immunogenic, means that it makes the immune system react, right? So that is where that aluminum hydroxide comes in.
Thank you, Dr. Ferdinand.
I hope I've been able to answer those questions. Yes.
All right. Thank you, Dr. Ferdinand. Caller, are you still there on the line?
Yeah, but she didn't answer, Dr. Fernand didn't answer the one, what is the chemical in the Sinopharm? This beta propyl, it's BETAPROPIOLACTONE. What is that?
It's a chemical. It's a, what do you call it now? Organic chemical. Okay? Just like how it's like an alcohol that you have to preserve it, you have to have something to preserve it, okay? And to keep it from going bad. So that's one of the preservatives in it.
Caller, have you, if you don't mind saying, have you been vaccinated?
Mr. Price, that is my personal business.
I know it's your personal, but would you be interested in getting vaccinated?
Pardon me? I asked a question, Mr. Price. All right, I just asking questions. Mr. Price, I want to know, what does this chemical do to the virus?
But the virus is already dead, caller.
Yeah?
The virus in this particular vaccine is already dead.
Oh.
So we activated it. Not, I mean, the laboratory has inactivated it, and it then mixes a little with this type of alcohol preservative, and with the aluminum, and that's what makes up the vaccine.
Okay, that's all I have to say.
All right, thank you very much for your call.
All right, bye-bye.
Thank you very much. All right, remember, you can call us at 228-5562 or 228-5563. We'll take a commercial break here and we'll be right back. Major Clarke, how much of a problem is misinformation in our local context? I mean, what are you seeing? How is it affecting how the people are coming to get vaccinated? What?
I certainly think it's a big problem because lots of misinformation and lots of an example is even giving us the information for our database. So we asked people for their email addresses, and people have given us wrong email addresses. But now that we're sending out the electronic certificates, of course, we've got to confirm these email addresses because we realized lots of people did not want to give the government their email address, so they made up ones and gave us. And now we're having to do a lot of calling to actually confirm email addresses. So a lot of misinformation about what we're going to do with the information, who we're going to share it with, and certainly the types of vaccines and what the vaccines are going to do to people. So there's been a lot of misinformation in terms of people coming to collect the vaccines.
Well, I want to ask you two questions now. The first is what are you doing to counter this level of misinformation? And the second one is I want you to tell us about the vaccination certificates.
Well, certainly we have been doing a number of public service announcements. Certainly Dr. Ferdinand herself has been meeting with lots of different groups, sharing information, explaining, and trying to get rid of some of the myths or some of the misinformations that have been shared with people. But of course, social media is very powerful, and as soon as we have put out correct information, somebody will put out some misinformation. In terms of the vaccine certificate, initially when we started, we were sending out an interim certificate, which only told you that you were completely vaccinated and when you got the doses. The Cabinet of Barbados has actually approved an electronic, digital certificate that we're now sending out. So we had sent out about 47,000 interim certificates. We've now started sending out the digital certificates. And it's a certificate that has a QR code. For people who try to download it on your phone, if your phone does not have the right software, it will be difficult for you to download it. So certainly you need to have a PDF reader so that you can actually get a PDF file, and it's actually signed by the Chief Medical Officer.
So what is this good for? If one is traveling, how helpful will this be? Will this be accepted overseas?
Certainly. So one of the issues with the interim certificate is we didn't actually say the type of vaccine and the batch number and the manufacturer. And so on this certificate, you will find that it actually says the type of vaccine you have, the batch number, where it was manufactured. It will give you when you got your first dose and when you got your second dose. So it provides all the necessary information for authorities in other countries to be able to confirm that you are actually fully vaccinated.
But the main question, is it accepted? Like if I go to the United States, Britain, Canada, they would accept this and I would not have to be subjected to a test over there?
I can't tell you wouldn't have to be subjected to a test. I can tell you that it is accepted to say that you are fully vaccinated. What the requirements for the countries, and this differ. I mean, you may still have to have a test, but certainly it would tell them that you are actually fully vaccinated. And I believe a number of countries have accepted it, so you don't have to quarantine as long as if you were not vaccinated. Sometimes it's a day, some places maybe 3 days, but it varies according to the regulations of the particular country you're going to.
A question that either of you could look at is, in Barbados, the law prohibits an employer to insist that a worker must be vaccinated in order to keep their job. We've seen in places like New York, for example, and other places in the United States where some employers are actually insisting that their workers get vaccinated in an effort to protect the workforce in general. And as I said, the law in Barbados is quite clear. No employer can insist on that here. But what I want to look at is, what are the rights of the persons within the workplace who have taken the time to get vaccinated? Is it fair for them now to have to work with someone who is not vaccinated and who comes up with all conspiracy theories why they should not be vaccinated? As I said, purely hypothetical. I'd like to hear your position on it. It's just your opinion.
Don't tell me ladies before gents. Okay.
I was going to say that.
You want to go first or should I?
You can go first and then I will go after.
All right. Let's look at it this way, and this is how I feel about it. I feel it is the duty of every single person to vaccinate them, to get themselves vaccinated, because they protect not only themselves, they protect all the members of their families. And we have to remember now that we don't have vaccine yet for the children under 18. And we've seen that there are some diseases going around when the children get COVID. So they have that responsibility, I feel, to look after themselves first, their family, their work colleagues, and then the actual nation of people themselves. All of Barbados. We should protect them as well as all the visitors who come to bring and spend money here. So I feel it is a civic duty to get yourself vaccinated.
Mm-hmm. Major Clarke?
I would certainly have to support that. Certainly, people, employees, if you are not vaccinated and you go to your workplace and then you go home, whatever you collect at home, you may bring to your workplace and put the entire business in jeopardy. So I would say it is the responsibility of every Barbadian to make sure they protect themselves as best as possible. And at present, besides the other protocols, vaccination is the way that you should go.
Mm-hmm. We have a caller on the line. Good evening. You're the People's Business. Go right ahead with your question.
Hi, good evening, sir. Okay. As a traveling sports ambassador to my country, normally, let's go into the household. If you have a headache, you run to the pharmacy, you buy Panadol, you buy Advil. When your body feels weak, you do the same thing for vitamins. So I don't see why is it relevant for the questions that are being posed to Major Clarke and the nurse lady. I met her personally. She's a very nice woman. I had both of my vaccines done in the presence of her. I had no complications. What I'm trying to say, why the 20 questions? In an outbreak, I was told back in the 18s or the 20s, where we had a pandemic that wiped out close to nearly 3,000 Barbadians. Now, there isn't vaccines for younger children, I understand that. If this was something mandatory, would there be 20 questions? No. But all I have to say is that as a colony, if we as Barbadian citizens holding passports, you mean a simple little thing like this to protect our own country, we can't come together? It starts from in the neighborhood. As you guys were saying just now, yes, it can be transferred from your house to establishments and from establishments to bigger entities. This is just like a project. We as Barbadians, yes, we need to be educated. We have common sense. There isn't much of us that lack common sense here on this island to know what is going on. We have to protect ourselves. We give God thanks for people like Major Clarke, the nurse lady there. You know, we always on the social media, we looking at everything that's happening outside. Okay, as far as your personal information is concerned, yes, it is private. How about those people out there? They're going to take it and spread it all over the place. Huh? I mean, I got to pause at this. Because your personal business is your personal business. They cannot point fingers at you guys. If they have their own personal business, they can go publish it for the whole world to see. Why question you guys about their personal business that is being withheld in a data bank?
All right. I don't know. Major Clarke, we want to respond to what the gentleman was saying?
Well, I mean, I think we have been very lucky to have the leadership that we had in terms of getting the vaccines, because we were, in real terms, we were fairly quick off the blocks in getting our first donation of vaccines from India. And so we actually went into the starting point very fast and started vaccinating people. And of course, we actually improved the system as we went along. It was a work in progress, and it's still a work in progress. And the idea is to make the quality of experience that people who come to our vaccination centers, to make it better every day. So every day we try to improve the system and to make it better, to make people more comfortable and relaxed when they come to be vaccinated.
Mm-hmm. All right. One of the things that I just go back to Dr. Ferdinand, one of the benefits of Sinopharm, I understand, is that pregnant women, well, pregnant women obviously can take it. Is that true, or is that false?
That is my understanding, yes. Mm-hmm. Generally speaking, when women are pregnant, especially during the first trimester or the first 3 months of pregnancy, when the egg is multiplying and the baby is developing, it's rapidly developing, that is the time when we do not like to give any chemicals, medicines, even smoking, alcohol. That's a no-no during those, especially during those first 3 months. So we don't normally vaccinate, not only during the first trimester, but throughout the whole pregnancy. Because whatever the mother takes in goes through the bloodstream and gets into the baby. But one has to look at the risks. This is a pandemic. Does the risk of having COVID versus having the vaccine? So we have to weigh the pros and the cons. If you are a frontline worker and you become pregnant, the decision as to whether to vaccinate or not comes up, because you are more at risk in your job that you're doing every day than if, as one of the callers said, she's at home, working from home, doesn't go out. So for her, you can take a risk and let her stay home and don't have the vaccine. But for somebody who's on the front line, one might look and say, yes, we need to give her, she's pregnant, we need her. Because one of the complications is that you can lose the baby if you have COVID. All right, so this particular vaccine can be given in women who are pregnant. The other vaccines we have not been, generally speaking, giving, and I'm not sure whether I would really fully approve of giving people at this stage where we are in Barbados, because we need to look at the risks, So that is an individual thing. If a lady knows that she's pregnant, see her doctor or come up to the centers, we will talk and discuss it and we will decide. Actually, today we had a case just like this, So it's something that we have.
All right, we'll take a commercial break and we'll be right back. Welcome back to the People's Business, where we're discussing Sinopharm, the vaccine that's now here and that's readily available, and the 8 centers where you can get that vaccination. Most centers open from 10, and Major Clarke and Dr. Elizabeth Ferdinand are here with us. Of course, you can give us a call at 228-5562 or 228-5563 to get your queries answered. I think we have a caller on the line. Go right ahead.
Good evening.
Hello. Yes, good evening. Go right ahead with your question.
Well, I have more a statement than a question. Question would come after. Now, for me, I have not taken the vaccine. I'm going to say that up front. I think we are all entitled to a freedom of choice. We have always had a choice. And I think that the persons that went and get the vaccine figured they needed the vaccine. Persons like me that did not take the vaccine have all reasons why we are not taking the vaccine. We are, what I'm going to say, of sound mind. And if I am of sound mind and I decide I don't want a vaccine, then I think that the consequences, whatever they are, I am prepared to take. Now, people are keep saying, and I realize the media are saying most of the time now that the people that are being infected are the unvaccinated people. But yet still, we know that vaccinated people can still catch COVID and can still spread the COVID. Now, my thing is, if we have freedom of choice, we should be at liberty to express our freedom of choice. That's just my take on it. And if at some point in time, because we know that all of these things are in trial stage, I'm going to say, every day, the doctors say, they're learning something new every day. And if we are learning something new every day, it means we do not have 100% grasp of what is actually going on or happening with the vaccines or anything. And my next point is, when we begin to put over health, we will always have a problem because we are trying to fight a race to open the country, to have trade and everything going on over the health of the people of the nation.
All right, thank you very much for that question. Dr. Ferdinand, would you like to respond?
Well, she didn't really raise a question as such. She made a statement, but everyone does have a choice. And I think Major Clarke said earlier that it is not mandatory. The government of Barbados has not made vaccination for COVID mandatory. Okay? So you do have the choice. But what I want to say is, you have the choice, but if you get that disease and you pass it on to somebody else who doesn't have the choice either, they got it from you, and they get into serious and die, how are you going to feel? Does that not have an effect on you? Would it not have an effect on you? So that's all I'm saying. So I mean, it's not mandatory, but try and use common sense, look at the problem, and see what you as an individual need to do.
What the question I would like to find out is how many vaccinated people in Barbados have become infected with COVID since they've been vaccinated? Because that's the one point that she had raised as well.
Yeah, I cannot answer that question. Okay. I think Dr. Corey Ford or someone who actually sees the patients, because we have no interaction with the patients as such. So that's more of an answer, and I think he or the CMO might be able to give that. I don't know, David, you agree with that?
I certainly agree with that. I mean, I think one of the other things besides that is somebody mentioned the adverse reactions, and somebody said they would not take it because of allergies, but we do have an adverse reaction database of people, and I mean, it's not a large group of people at all. We've given, as of today, we've given 98,200 first doses, and the number of people who have had adverse reaction, I believe, is quite small. But Dr. Ferdinand might be able to comment on that.
Mm. How quite small is quite small? Less than 100, less than 20, less than 50? How much?
Less than 500. And I'm talking about, talking about swollen arms, fever, fever that went on for more than, say, 24 hours, you know. We've had some rashes, different things, and some blood clots, yes. All of those. So let me tell you some, let's maybe explain a little bit. There is a website that is run by the Barbados Drug Service where anyone who's had the vaccine or anyone who has any reaction to any drug can go on to this website and read it. Okay? There is a committee of which I sit on that looks at all of these reactions as far as COVID vaccination is concerned. And that committee has what we call an investigative team made up of a public health specialist, a public health nurse, and an ambulance officer. And these three people investigate. They look at the more serious ones because there's a variety. There's mild, moderate, and severe reactions. And they pick out the more severe or moderate ones, and they go and visit these people and get the whole story. And then the committee looks at it and see whether that reaction could be what we call attributed or caused by that vaccine. Now, the results, not only the results, but those results plus all the people who have called in any of these cases are sent to PAHO or Pan American Health Organization and then on to the WHO, World Health Organization, because they are looking at all the complications through the world for the different vaccines. Because as we said, this is a new disease, these are new vaccines, and we are looking to see what could be the possible complications worldwide from vaccination, right? So if you're so sick, you have to go back to the doctor. The doctor reports that to the same website. You as an individual can report it yourself, okay? So that's how that committee works.
Of the 500 cases, of about 500
I'm saying
cases, roughly, how many would be categorized as very serious?
I really cannot answer that question at this moment. I'm not the chairman of that committee. I'm just a member of the committee, but I can't answer that right offhand.
Okay. We have a call on the line. Go right ahead with your question. Hello?
Hello.
Yes, go right ahead with your question.
Okay, good night to everyone.
Good night.
I would like to ask two questions, please. The first one is, has the vaccine from Cuba been approved as yet by the WHO? And if so, how soon can Barbados expect to receive the vaccine from Cuba?
All right, thank you. Did you get the question, Dr. Ferdinand?
Yes. No, the vaccine from Cuba has not been approved as yet by WHO. And I'm not sure where, as soon as it is approved, then, and we Barbados can get it, then I'm sure Prime Minister look to see how we can obtain some of those doses.
Okay. You made some points about the after effects of the vaccination, but what I want to look at now is some of the after effects of COVID. I've read that erectile dysfunction, for example, is one of them, and there could be some others. I think this is information that we need to find the truth about this information, because I think it would help some people decide whether or not they should have the vaccination. Dr. Ferdinand, I don't know if you can comment on this.
Well, yes, I can. COVID is a very dangerous disease. It not only makes you ill, causes you to be hospitalized, causes you to be put onto ventilators, and can cause you to die. It can do what we call lasting effects. So you've gone to hospital, or you might not have gone to hospital, but you've had COVID, and in 4 or 5 months of this, we found that a lot of people are realized because the germ has damaged your heart, your kidneys, your liver, and other organs of your body. And it can eventually kill you or make your quality of life very poor. Now, there's nobody who can say, well, this particular person is going to have heart problems after, or particular person going to have kidney problems. We as doctors cannot foresee who is going to have the complications and who is not. But all we can say is that some people will get complications, and it may vary what complications they get.
And the question I asked, is erectile dysfunction one of those complications? I think a lot of men would want to know that.
Well, yes, my understanding is that does occur, and especially in the younger person, the younger man. And I think I said in a news clip recently is that which young man, if he does have, or even if he's an older man or an elderly gentleman, gets erectile dysfunction, is going to wave a flag and say, look, I had COVID and I got erectile dysfunction from it. It's not something that people are going to wave and publicize. So it can occur, it does occur, and we don't know who will get it after COVID.
All right. We'll take a commercial break and we'll be right back. Welcome back to the People's Business, where we're focusing on the Sinopharm, as well as we're looking at the need for vaccination. We have a caller on the line. We'll go straight to the call. Go right ahead. Go right ahead with your question.
Hello?
Yes, go right ahead.
Oh, yeah. So what I was, my query is that I had my first vaccine on the 19th of May. I haven't gotten the second one as yet. So I'm wondering if I shouldn't have gotten it since then.
Just stay on the line, Major Clarke. I can't hear Major Clarke.
The second dose is given 8 to 12 weeks after the first dose. So if she had it the 19th of May, it would actually be due this week, sometime this week.
Because the blue card has said the 20th of June.
If you got it the 19th of May, when we started the process, the original process, it was decided, the manufacturer's recommendation was that we would give it 4 weeks after the first dose. Okay. However, our medical committee, on reviewing all the data, changed that to 8 to 12 weeks because the efficacy or the strength of the vaccine improved.
Okay.
So we changed that.
Mm-hmm. Okay, and will it be the same type or another type?
It will be the same type. when the vaccines arrive, we separate them in half so that you put aside half so that there will be vaccines for your second dose.
Okay. Understood. Thank you all very much.
Caller, don't go. Caller, don't go, please. Could you tell us why you decided to become vaccinated?
Why?
Why did you decide to get vaccinated?
Oh, I am a senior person. I'm 75. Okay. And I am not mobile. They came to my home and I got it at my home. And I knew about getting vaccinated from the time I was a child. I'm not scared. I think it is safe to do so. I've had all types of vaccinations already. The last one I had was against chicken pox. So therefore, I feel free and comfortable.
So do you have young people within your household who have declined to get the vaccination?
No, not at all. Not at all. Not at all. Everybody lives on the safe side. They try to be as safe as possible.
All right, caller. Thank you. And
could I say something,
yes,
Sanka, please?
Just on the line, caller. Go right ahead, Dr. Ferdinand.
Caller, you said that they came to your house and gave you your first. Is that correct?
Of course I say that.
Okay, fine. So we will come again. We will come again and give you the second.
Yes.
If you don't get one within the next week or two, please call our line so that we can flag you to get it. All right?
Yes, I was just concerned about the length of time because I wasn't sure.
Yes.
Okay?
Yes.
Oh, so I will wait. Well, thank you all very much.
Thank you for calling.
My family will continue to stay on the safe side.
Thank you very much.
That's good to hear.
Thank
you. She's talking about on the safe side. In the last 8 days, there have been 22 new cases. In fact, for the month of July, we've gone from 31 persons in isolation to 152. I know this is not really your area, either of you, but what does this really say about what is happening in Barbados in terms of vaccinations and the need for vaccinations? I don't know if you want to stick a pin, hold that thought while we take another call first. Let's take a call. Let's take the call. You're on the air. Go right ahead.
Hello, yes, good evening.
Good evening.
Good evening to your panel. And I wanted to ask two things quickly. On the clip at the beginning, there was a comment by one of the persons regarding taking the vaccine for travel. The question is, with a lot of the information going around that the Indian made serum may not be eligible in some European countries, I want to know if that's really the case, because I don't like to believe everything I've heard. Is that the case? And if so, how do we get around that? And then the second thing is that I've got my full 2 doses, but I think there was a certificate that often comes out after your second dose. I've never received that. How important it is to receive that? Those are my 2 questions. Thank you.
Okay. Who wants to go first? The AstraZeneca may not be accepted in Europe.
Well, I can go first. I have recently learned that the European Union have issued what European passport, vaccine passport, and that there were only about 3 or 4 vaccines that they were accepting. So in other words, if you didn't have Pfizer, Moderna, and AstraZeneca that was made in Europe, they wouldn't accept it. This does not mean that they're not at some countries. I heard about 10 countries then, did not go along with that. 10 of the European countries did not go along with that. So there might still be some countries in Europe who will not accept our Covishield, or maybe the one made in South Korea. But there's nothing that I can do about that at this stage. Each country has their own rules and regulations, and they can make their own rules and regulations. Most of the time, countries are usually governed by what the World Health Organization say. And WHO came out and strongly said that all the vaccines that they have approved should be accepted. You know, it's like you don't take fruit cake that is made in Barbados, but you will take it that's made in Guyana. You know, fruit cake is fruit cake. So that's the kind of dilemma that we have, and the kind of thing that countries now are facing all over the world. But life, and until the rulers come to a decision, there's not much that many of us can do. So in a nutshell, what I've said is that, yes, my understanding is that some European countries have passed this, I mean, the countries that they've passed this European passport thing, but some of the countries are not fully agreeing with what they said, which is no Covishield, which is no AstraZeneca from India or South Korea. Okay, so that's my talk on that.
Before you start, Major Clarke, the fact is that I think that whole scenario is caught up with the geopolitics as well, and that has been well publicized. Let's go to since we have another call on the line, let's go to the second part of the caller's question, dealing with the certificates.
Right, so the certificates, well, your blue card, immunization card, is actually your official document. What we have done is we've produced a digital certificate with a QR code that people can use if they're traveling. We started sending out, as I said, an interim certificate because people wanted something digital. Now that the cabinet has approved, we have actually started sending out the new certificates. We've got about 73,000 of those to send out. We have started sending out, and where people who are traveling to destinations that may need a digital certificate, we will try to, once they put in a request, we will try to send them the certificate. But we will be sending out as long as you have given us an email address. And as I said, lots of people gave us fictitious email addresses, but now that they want the electronic certificate, they're calling us, giving us the correct email address. So certainly it has given us a little bit more work than we expected.
Thank you, Major Clarke. Caller, we have a caller on the line. Go right ahead with your question.
Hello, good evening. Can you hear me?
Loud and clear. Go right ahead.
Hello, thank you very much. This is more of a thank you than a question per se. I'm from London, England. My wife is a Barbadian, and I would just like to express my appreciation to the Barbadian government, to Major Clarke, to Dr. Ferdinand. It's a great thing that you're doing. I am waiting for my second dose of AstraZeneca, but I would take the Sinopharm immediately if it was, if I wasn't waiting for my AstraZeneca. Both of these vaccines are approved by the World Health Organization, and let me say from my research, there's countries and people crying out to get this vaccine, and I'm just very grateful that we have it here in the country. So thank you very much for all of your efforts, and good luck.
Caller, thank you for your comments, but caller, could we ask you a couple of questions?
Yeah, of course.
Tomorrow, in England, in fact, the UK is opening up. You said you're from the UK. What are your thoughts on that?
I think it's an absolute madness. I think that people are not taking care in many Western countries, the UK prime amongst them. I feel that opening up at this stage is going to cause more variants and more mutations, and it's just going to be more dangerous for all of us. So that's why I think it's best to nip it in the bud now, and everybody who can should get vaccinated.
So you live here, caller?
Yes, sir.
And from what you're seeing in Barbados, what are you comfortable with or uncomfortable with as far as how we have been handling our whole vaccination process? You have the coordinators right here. Let them know.
No, I mean, again, I just really appreciate all the efforts. I think I feel far more fortunate to be living here in Barbados than back in the UK. I think we're doing really great, and we should just continue on with the path that we're doing. And I would encourage everybody to get vaccinated if they can.
All right. Thank you very much, and stay safe.
Thanks.
Okay. Dr. Ferdinand and Major Clarke, I was making the point earlier before I took the two questions about the last 8 days. There have been 122 new cases, and for the whole month of July, we've moved from 31 persons in isolation to 152. And I was just trying to get a feel from you as to what is this really saying about how Barbadians are dealing with COVID and the protocols in terms of vaccinations, in terms of the entire reaction to what is happening to the whole pandemic, the whole perspective of the pandemic. What are your thoughts on that?
Well, if I could go first this time, Doc.
Yes.
Certainly, I think when Barbadians look at the dashboard and they see that we're doing relatively well within the, certainly in this region, they have started to relax and not follow the protocols as they should. And we must always remember to stick to the basic protocols: hand washing, wear your mask, sanitization. And if we stick to those protocols, and I think what has happened is that people have become a little complacent and relaxed those protocols, and certainly we saw the results of that.
Mm-hmm. We'll certainly have.
And I want to agree with what Major has said. And they've guard down, they've become complacent. I mean, partying and going out, and you see children coming home from school, they mask under their neck, mask at all. You just have to drive down the road and you look and you congregation of a few people, how many are wearing masks? And it's not only the young ones, all ages. And I think also a lot more people need to get vaccinated. When the country reach herd immunity, and I like to say 80%, I want to be on the safe side, like 80%, less circulation of the virus. And so less people will get it until we have 0 cases.
Mm-hmm. All right, we'll take a commercial break and we'll be right back. Welcome back to the People's Business. We have less than 10 minutes to go to conclude the program. And I just thought I would ask Major Clarke and Dr. Ferdinand how they have been personally affected by this whole pandemic, this work. Because I know Dr. Ferdinand was retired and resting, volunteer work, but was retired. But before we just go that, we'll take a quick call. You're on the air. Good evening.
Hello, good evening.
Yes, go right ahead with your question.
This question would be for Dr. Ferdinand. Could you say, or is it possible that you can say how you should treat your immune system, or in the sense of what can you take or what you can't take, especially if you have like a chronic problem, or even if you don't have chronic problem. They haven't said anything other than yes, keep yourselves, I presume, as clean as possible. But they haven't said like, okay, what should you do? Should you drink more water? Should you drink more vitamins? I haven't heard anything down that line. Is it possible you can see?
Go right ahead, Dr. Ferdinand.
Yes. Well, you need to boost your immune system. And anything that you do that can boost your immune system will make you in a position to fight off the infection if you get it, or to stop you from getting it in the first place. You have to have a well-balanced diet, plenty of rest, water. They say vitamin C and vitamin D are good as well. And you can add your multivitamins if you want. So you eat fruits and vegetables, your usual, try to have as well a diet as possible. Supplement with vitamin C and D, and drink plenty water, rest and exercise. The usual basic things, okay? And anything else that you might know that can boost your immune system. That's my advice.
Thank you. Thanks to the caller. And your final comments. I asked you a quick question there just now. How did this impact you? Dr. Ferdinand, you can go first.
Well, as you said, I was in retirement, been in retirement for nearly 7 years. Yes, I was busy doing other things, but I felt that when I was asked by the Prime Minister to come and head up this project, I really thought it was, I needed to do it. I wanted to do it. It has impacted me and my family, of course, because I'm out every day. Initially, it was till late at night. We were there at work all day long and night. And so it has had a toll on us, yes, but I am loving it. I'm enjoying it. And it's just, I can't say anymore.
And what about you, Major Clarke?
Well, I can say that I've had some long days. I have some very long days. I start very early, and sometimes we finish very late. Certainly, it's a 24 hours, 7 days a week job. So I believe my team, we've been going from the 1st of February nonstop. I've had the opportunity to meet some wonderful people in the public health system. We have some very committed doctors, nurses, public health sisters who are there for the greater good of Barbados and health. And the volunteers, and I must say, we have a team of volunteers, the callers, the people who help, who give of their time to help us through this pandemic. So I can say it has been, like Dr. Ferdinand, a wonderful experience. And certainly, although I've probably not had any days off, it has certainly been a wonderful experience for my team, and meeting all of the players that have taken part to get us where we are today. There are some people that I would certainly bring into the Defence Force, some volunteers who at present I have no authority to command them, but they're just as good as the soldiers we have.
Mm-hmm. And your final remarks that, in terms of the whole process and sign up for the Sinopharm and getting vaccination?
Well, I would certainly like to encourage everybody to sign up and get vaccinated. As you know, we got 30,000 doses. We divide that in half. The difference with the Sinopharm to the AstraZeneca comes in a vial of 10. The Sinopharm comes in single doses. So it's much easier to divide 15,000 in storage and give 15,000 out to vaccinate people. So it's a much easier process, and I certainly want to encourage people to come and take the vaccine so that we have nothing in storage at the end of the process.
And how long do you think, very quickly, how long do you think it will take us to reach at least get another to reach at least 70% of our population. We're at 27% now.
It really depends on the supply of vaccines. And so our government, they're actively seeking donations or to purchase vaccines. Once we have the vaccines in storage, we will certainly be able to dispense them. And as long as the people come forward to take the vaccines. But at this point in time, it is when we are going to get our next shipment and when vaccines will arrive in the country. And that will dictate when we get to herd immunity.
Thank you very much, Major Clarke. And final word is with you, Dr. Ferdinand.
Well, I want to first of all thank all those who come forward right away and had their first and second doses. I want to encourage those who have not been vaccinated to come again, come and get their vaccine. And I want to thank all the staff and, as Major has said, the volunteers and our team for the wonderful work that they're doing, and for the government to getting the vaccines, because if we didn't have the vaccines, we could not vaccinate. So, and to stay safe, everyone, please don't let your guard down. We're counting on you to keep well and let our country.
Thank you, Major Clarke and Dr. Elizabeth Ferdinand. And I just want to remind everyone who's watching this who's not vaccinated. As I said, in the last 8 days, we've had 122 new cases. Yes, when you're vaccinated, you can become infected. That has been said repeatedly, but the point that is made is not as severe, and you're unlikely to die. You're unlikely to be end up on oxygen or go through a tough time of it. So from where I sit, it makes sense to become vaccinated. But of course, it's not mandatory. You can make a decision. But I think you need to weigh that decision against everything else that's happening around you. Think about it. Think about your safety. Think about the safety of those you love. This is Sanka Price. Have a good night.